Hello, everyone. My name is Christy Amobi, and I work with Orfit. I'd like to welcome you to today's event. As many of you know, immobilizing the lower and upper extremities for radiation treatment over multiple fractions can be challenging and difficult, often requiring a mix of back bags, cushions, masks, and tape, which can introduce uncertainties. We are delighted to welcome Razmig Zovigian, lead radiation therapist for MRI and CT at City of Hope in Duarte, California, located in the Los Angeles area. Today, he will describe how he and the clinical team at City of Hope have been able to achieve better reproducibility and patient comfort using a special extremities device. Mr. Zovigian will also discuss how to adapt the immobilization device across several different uses to support optimal and customized patient treatment based on the unique parameters of the patient's tumor, mobility concerns, and care plan.
Hi, thank you, Christy, for that introduction. So I'm going to move on to the objectives. We're going to talk about today some limitation of the common extremity treatment setups, and also how to achieve it to become better reproducibility and patient comfort using a special extremity device, and describe also how to adapt the immobilization device across several different uses. Okay, as a background, I'm a lead technical radiation therapist at City of Hope, and I started, before I started City of Hope, I started diagnostic imaging in 2000, performing MRIs and CAT scans. And after 6 years later, I attended City of Hope Radiation Therapy School, and I've been there since then. So I've been at City of Hope for like 15 years. About City of Hope, it's 21 miles of north of Los Angeles in Duarte, California. Its culture is diverse and inclusive with a strong sense of community. And also as a National Cancer Institute designated comprehensive cancer center, which is providing a care from prevention through survivorship, and also innovative radiation oncology department. Well, but being part of this radiation oncology department, leading the way to improve patient care with the latest radiation treatments and technology, also emphasizing on precise imaging and selective target treatment. So type of cases that we use these treatment modalities in this department for extremities are like for upper extremities, we treat humerus, elbows, forearms, and hands. Lower extremities such as hip, thigh, knee, hip, ankle, and foot. And the radiation treatment modality that we use is like the three-dimensional conformal radiation therapy, stereotactic body radiation therapy, intensity modulated radiation therapy, and image-guided radiation therapy. Setup of difficulties and challenges. So before having this extremity solution, we used to use the major challenge that we have is the reproducibility of the treatment day to day, plus the patient comfort, and also the duration of the treatment time due to primitive setups. So the primitive setups that we had on the upper extremities before the solution board was the patient was positioned in back bag, and the hand was immobilized with the head base plate and a custom cushion and a mask, which wasn't med-tech to the table or bolted to the table. The difficulty to reproduce the same setup day to day due to the immobilization method not bolted to the treatment couch. Lower extremities, same difficulties and challenges as a patient position with large back bags with a budding base plate accompanied with custom cushion and a mask. And also the adjacent non-affected leg was elevated with another back bag, so the leg will be away from the path of the beam. And also when we elevated the leg with the back bag that it was used, it wasn't indexed to the table. So day-to-day positioning have a difficulty to put in an accurate place where the unaffected leg will be away from the radiation. Improvements. So after the solution board, the improvement was that patient molded can be bolted down the treatment table, which is we know where to med-tech it, and also we can tell the position of the patient with the table position solution board and med-tech the table. The superior improvement was that is the reproducibility, masking the area of treatment bolt down to the table. Patient comfort, we use custom cushions and backpack abutting to the solution board. The setup time was much shorter because of the solution board being MatTech table and the backpack MatTech to the table made it easier for the reproducibility and the treatment time faster. And also create an accuracy setup. And the leg support, which is the unaffected leg, we were using the backpack. Now we use the leg support box, which is we can also mask the leg on that too, so we know the position of the leg and where it's going to be falling day to day for the treatment. So as you guys see, this is the video that I'm going to be showing before the solution board, the positioning device that we were using to elevate the non-affected leg with the backpack under the leg and not even MatTech to the table or bolted to the table. So we can tell if it's how far it's going to be in and out position and left to right position for the leg to be at. And then the side, at this point, the affected side will be masking with the base plate and the mask on, as you guys are going to be seeing next. So I'm adjusting the foot over there. So at this side, you can see we're using the base plate with the mask. And also that leg is not bolted to the table. The base plate, as you can see, is hanging off the table. Now with the solution board, as you can see, we can MatTech to the table, and also the leg support box, we can put it on top of it where there's numbers on it, and you can tell the location of the box where it's supposed to be. And with the backpack on the back, and also the leg is elevated, we know where it's going to fall day to day. And we use the custom cushion to make it more comfortable for the patient under the foot and under the knee. So that way they'll be comfortable enough if they're without moving. That's how I'm putting the custom cushion under the foot. And also we're going to make a custom cushion under the knee. So now we're going to use the mask. So we have a different type of mask. We have a foot mask, and also we have a regular mask that I put it on. That's the foot mask that I'm opening right now. And we have a foam that we put under the ankle on top of the leg support box. So that way the ankle will be comfortable for the patient. As you can see, this one over here, we're masking the non-affected leg that we know where it's going to fall. Also, there's a numbers where we clipping onto the box. And the same thing for the foot. And it's very easy to clip it on. As you can see from this view, that the foot and the custom cushion under the knee, and you can see the markings on the extremity solution where you're gonna clip the mask on. And from day to day, from this point when the patient goes from CT to the treatment, we know where is it marked at, where we're gonna put the patient's foot and the mask on, so that way it will be reproducible without difficulties or challenges. Also over here, you can see that there's a documentation. If you want to mark the area where the mask is supposed to be, you can put the patient name, and for each the solution board and the leg support and the mask that you use, you can document on the paper, which is very helpful. On this one, we're gonna the setup by treatment areas. That's for knees. We do the mask above and below the knee, so that way we can have a support of the knee. So that way we know where it's falling in and out and laterally and longitudinally. For thighs, we usually put for backpack under the pelvis with the butting extremity board and masking of the knee and the foot for controlling the rotation. But whenever we do thighs and they don't want to rotate the legs or move the rotates, we make them mask the legs, the foot, so that way the leg stays straight all the way up to the hips. The foot, as you guys see, we do the custom cushion with the mask to control the rotation. Shoulders, for upper extremities, we have the custom cushion under the shoulder on the extremity solution. Then we make the mask over it and the mask on the elbow, which is have a dedicated elbow mask that Orfit has it. It's very helpful. And you can control the upper arm very immobilize it very correctly. So day to day, you can reproduce the same position for the treatment. And plus for the hand, also there's dedicated hand mask from Orfit and with the custom cushion, and also it's very helpful where it controls the rotation of the hand. In summary, our physicians, they like this solution board because of the reproducibility as we discussed, and also for each body part, they can request a certain approach to it. As when you put the non-affected leg up and keep the affected leg down, and the beam of the path of the beam will be away from the radiating the non-affected leg. And also with masking it, we know that it's going to follow the same position for any SBRT, IMRT. It's very important to have that the exact location of the non-affected leg. And also when it comes to the thighs, some doctors that when the tumor is posterior, they don't like the thigh touching the table. So we can put a backpack under the pelvis to elevate the pelvis, and we'll put a custom cushion under the knee. So elevated, so that way the thigh is not touching the table and the tumor is not shifting day to day. For foot, same way, they like the foot masking because of the rotation, so the patient won't be able to move the foot or rotate the foot in different directions, so that way it won't change the position of the hips and the knee when they're treating. As it goes, the same thing for the hand. So that's why our doctors are very acceptable with this device, and they want us to use on all our extremity treatments, especially lower extremities and upper extremity treatments. And for patients, it's very comfortable because we always think about patients' comfort when it comes to simulation. And every time we ask them if they're okay, they'll tell us, yeah, they're okay with the position and they're comfortable, so no complaints from there. And any questions?
Okay, thank you so much. First question, have you seen any improvements with setup times after the initial setup?
Yes, it does help a lot with the setup times because we don't have to struggle to figure out the positioning day to day.
Okay, thank you. What type of setup data do you get for Orfit? Is there any setup data for Orfit?
Setup data, yeah, the setup data for Orfit is just information that we get from the scanning portion of it on day to day, and we can adjust it accordingly. And sometimes if the patient not lining up, we can just get it done correctly.
Okay, next question. How do you reproduce the mold care position under the foot?
Well, under the foot, we have the foam that we put on, and we have the custom cushion, which is placed under it, and we know where it's going to fall day to day. So we use custom cushion on every patient for the foot.
Okay, thank you. Can you describe more around the decision there at City of Hope to keep the untreated foot high and the treated foot down?
Well, we realized that the reason we keep the treated foot down because it's more stable to be laying flat on the table than elevating it. So that's what we decided to do, the non-affected leg down and non-affected leg up and affected leg down. So that way it's more reproducible day to day.
Okay, thank you. Next question. As a therapist, what are some of the challenges you see in head and neck treatment?
The challenges on head and neck treatment is usually when patients lose weight, that's the difficulty starts, and then we have to figure out a way to position and also the chin position, the neck position. So day to day, the head and neck is the difficulty is to get the same position on and on. So we use the different masking process for it, and also we put a custom cushion under the neck so we can reproduce the same position. And plus, it's a patient comfort.
Okay, thank you. Next question is around potential collision issues. Do you see any collision issues or potential collision issues with the gantry?
If it's that's what we decided from that point to use. If we put the affected leg up, you will have a collision issue posteriorly when the gantry is rotating because the ISO is too anterior. So that's why we decided to put the non-affected leg up and the affected leg down, where the ISO is more centered. And then we use tomotherapy or true beam, doesn't matter which one. And we verify, we do a dry run on a daily basis to confirm from the beginning before we start with the treatment.
Okay, next question. There's just quite a few coming in, so I'm making my way through them. Next question. How does the raised board attach to the table, and are you using a locking bar?
Yeah, so the extremity solution board is a MedTech locking bar to the table, and the raised board, the leg support, is locked to the solution board.
Okay, and could you also describe how you showed it in the video, but how the masks also lock into the board? Can you describe that process?
Yeah, so there's multiple holes on the board with numbers on it. So each mask has a small clips on. So when you clip it on, it could be multiple areas, but at least the board has holes, and you can lock it directly to the board itself.
Okay, next question. How do you CT sim the hand forearm with the board? Is it usually the arm over the head or the arms by the side? And if the arms are by the side, are there any additional considerations for the body besides the arm?
Well, if it's it depends on first of all on the tumor location and how the doctors are expecting the simulation done. But most of the time that we use it with the arms on the side, and we offset it to the side, the patient, and the board, the opposite side where you have more space. We can MedTech the arms to the table, to the board itself.
Okay, next question is around compatibility. I think you covered this, but I just would like to ask it again. Is the Orfit system compatible with the tomotherapy tabletop?
Yes. It's compatible to every machine. That's my approach on that.
Okay, next question. What is there any additional tips or tricks that you have for setup?
Tricks or tips? It's very simple. There's no tricks, honestly. But the tips is that whatever the patient tumor, according to the tumor affected side, the tumor location, and according to that, you can adjust this board any way you want and make it reproducible and usable for every patient.
Okay, this is the next question around the sort of the foot setup that you guys are doing there. Can you do SBRT with this particular kind of setup where you have 1 foot up and 1 foot down?
Yes. Because we use it on all SBRT cases or sarcomas, which is IMRT cases. So every case that I approach with IMRT, I approach it as SBRT simulation.
Okay. Next question. Are the Orfit mask remoldable Are you able to reheat them and try again if there's any issue?
Yes.
Okay, do you see any imaging issues when using this solution with a surface guided imaging solution or any type of the surface guided setup?
Well, the surface guided setup, you can use the mask on the area where you're treating, so you can, whatever, the way it is with the surface guiding, wherever there's no mask, you can use the surface guarding. So you can use it with the surface guiding if the mask is covering the area.
Okay, next question is, are there any exit dose issues with the elevated non-affected leg?
Exit those issues? That's the question again, Christine?
Yes, are there any exit dose issues with the elevated non-affected leg?
No, I haven't heard any complaints from the physicists or the doctors about it.
Okay, next question. Again, there's just coming in, tons coming in here. Hang with me. We've got about 4 more minutes for questions here, so I'm going to try to get through as many of them as possible. If I don't get a chance to ask your question, we'll certainly follow up with you via email. Next question, what is the setup? Are there any setup errors that you usually get?
The setup errors that I usually get is that usually when you're doing extremities on the side, you have to be careful where you place the board. If the board is not at the right spot, it will cause collision factors. That's the only errors.
Okay, yeah, the next question is similar to that. Do you ever have to offset the base plate left or right to decrease the collision issues?
Definitely.
Okay. Have you ever had any issues with the raised board being too high that you cannot scan?
No.
Okay, and have you ever had any issues where the patient is unable to get, their leg in that high of a position, get their extremity in that high of a position?
Yes, I had patients like that. At that point, we will be having a discussion with the doctor, and I think usually we frog leg it if it's close to thigh, then we probably have to find out another approach to this treatment, to the patient treatment.
Okay. Are you aware of any weight limitations with the extremity solution?
There's no weight limitation on extremity solution.
Okay. You stated that you also work in MRI. Is the equipment MR conditional for sites that also receive MRI simulations?
Well, I think the Orfit has a dedicated MRI extremity solution board.
Okay. And another question, does the cast or the mask lose elasticity if you reheat it?
If I reheat it, the elasticity, no,
Yeah.
it's the same.
Okay,
No
it's
change.
the same. Okay, great. Are there any other differences with the masks, the extremities masks that you're using compared to other masks in the department?
Okay, in the department, this is the mask that we use for Orfit for. The differences, I think they're all the same. I don't see any differences.
Okay. And final question here. Thank you guys so much for being so engaged in today's presentation. I do want to respect everybody's time here. So this one final question, how often are you using this setup for sarcomas?
At all time, on every sarcomas we use this.
All right. Okay. Thank you again for everyone's attention today. On behalf of Orfit, I'd like to thank you, Raz. You did a fantastic job with the presentation today. As I mentioned, there were a number of questions that we weren't able to get to, so we will be following up with you regarding those questions. There was also a question regarding what is this board called? It's called the Extremities Solution, and it's manufactured by Orfit. Thank you again to Mr. Zovigian for this excellent presentation, and with that, I will close today's session. Thank you so much.